Hey everyone, and welcome. Today, we're going to tackle a topic that affects so many people but is often surrounded by a ton of confusion: uterine fibroids. We're going to break down what they are, what causes them, and most importantly, all the latest ways to manage them. So let's dive right in. Okay, let's kick things off with a number that might just stop you in your tracks. Somewhere between 70 and 80%. That's the percentage of women who will develop fibroids at some point. It just goes to show you how incredibly widespread this is. So if this is something you're dealing with, you are definitely not alone. So here's our game plan for today. First up, we'll get clear on what fibroids actually are. Then we'll get into the symptoms and why they can have such a big impact. After that, we'll investigate the causes and risk factors. Then, the exciting part, we'll open up the modern treatment playbook. And we'll wrap up by looking at the powerful role your own lifestyle can play. All right, let's get right down to it. Let's start with the absolute basics. What are we even talking about when we say uterine fibroids? So a uterine fibroid is a benign growth. And I really want to emphasize that word, benign. It means it is not cancerous. It's actually made of the very same muscle tissue as the uterus itself. It's just growing in a little bundle, kind of fueled by hormones. The key thing to remember is this is an overgrowth of normal tissue, not cancer. When it comes to fibroids, it's all about location, location, location. Where a fibroid decides to grow is absolutely key, because that's what determines the kind of symptoms it might cause. Submucosal ones bulge into the uterine cavity. Those are the ones often linked to heavy bleeding. Intramural fibroids are the most common. They're tucked right inside the uterine wall. And then you have subserosal ones, which grow on the outside. As you'll see, where they are matters a lot. Okay, so we've covered the what. Now let's connect that to the real-world experience. For the 30% or so of women who actually get symptoms, what does that feel like? Why do you feel this way? Well, the symptoms can be all over the map. For some, it's those really heavy, long periods, or just a constant feeling of pressure down there. For others, it might be having to pee all the time because a fibroid is pushing on the bladder. It can even cause pain or lead to issues with fertility. The bottom line is, the impact on your daily life can be huge. And out of all those symptoms, there's one that stands out as the #1 complaint, and that's abnormal uterine bleeding. This is by far the most common issue people face. And it's not just an inconvenience, All that blood loss can actually lead to anemia, which leaves you feeling exhausted, weak, and just drained. So this all leads to the big question, right? The why me? Why do these things develop in the first place? Let's take a look at the science behind the causes and risk factors. The main culprit is pretty clear. It's hormones. Specifically, estrogen and progesterone act like gasoline for fibroid growth. This totally explains why they pop up most often during a woman's reproductive years. And then, almost like magic, they tend to shrink after menopause when those hormone levels naturally drop off. It's a really direct link. But it's not just about hormones. There's a whole cocktail of other factors at play. Genetics is a big one. If your mom or sister had fibroids, your risk goes up. We also see it happen more often and more severely in women of African ancestry. Your age, lifestyle factors like obesity, and even when you started your period can all play a role. It's a really complex mix of things you can and can't control. Okay, we've talked a lot about the problem, so let's get to the good stuff, the solutions. The fantastic news is that the way we treat fibroids has come such a long way. So let's open up the modern playbook and see what your options are today. Now, the first line of defense is usually medical management. The goal here is just to get the symptoms under control, especially that heavy bleeding. And when you look at the data, it's pretty eye-opening. Some medications, like omeprazole acetate, can successfully control bleeding in a whopping 96% of cases. A hormonal IUD is also a heavy hitter at 88%. Even oral contraceptives can help, though they're a bit less effective. So, what happens when meds just aren't cutting it? Well, that's when surgical options enter the picture. A really common procedure is called a myomectomy, and the whole point is to just take out the fibroids while leaving the uterus intact. This is an absolutely crucial option for anyone who wants to preserve their fertility. Now, let's compare the two main ways to do this surgery. You've got the traditional open surgery, or a laparotomy, and then the minimally invasive approach, laparoscopy. Open surgery might be a little quicker in the OR, but look at the trade-offs. With the minimally invasive route, your hospital stay is nearly cut in half. And get this, the number of people needing strong pain meds plummets from over half to just about 6%. That's a massive difference in your recovery experience. And the innovation doesn't stop there. The technology is getting really, really cool. There's something called uterine artery embolization, where doctors block the blood supply to the fibroids, which basically starves them and makes them shrink. It helps about 70% of patients avoid a bigger surgery. Then there's HIFU, which is completely non-invasive. It uses focused sound waves to literally cook and destroy the fibroid tissue from outside your body. No cuts, no incisions at all. So with all these amazing medical options, you might be thinking, okay, but is there anything I can do myself? Can things like diet and exercise actually make a difference? Let's take a look. Turns out what you eat can play a really significant supportive role. The thinking is that things like fruits, veggies, and dairy, foods that are rich in vitamins and antioxidants, might help your body balance out those hormones we talked about. On the other hand, things like red and processed meats have been linked to a higher risk, possibly because they can increase inflammation. And check out this specific stat because this is a big one. One major study found that women who had enough vitamin D had a 32% lower risk of developing fibroids compared to those who were deficient. I mean, that points to a pretty simple, actionable thing that could have a real impact. And of course, we can't talk about lifestyle without talking about exercise. Regular physical activity is just a powerhouse. It helps regulate the very hormones that fuel fibroid growth in the first place, and it helps your body manage insulin better. It just creates a healthier hormonal environment overall, which can be a powerful protective shield. Okay, so let's boil all this down. What are the absolute key takeaways here? Number 1, fibroids are super common, and they are almost always benign. Number 2, symptoms all come down to location, but heavy bleeding is the biggest complaint. Number 3, there's a huge and growing toolkit of treatments, from simple medications to amazing, minimally invasive procedures. And finally, number 4, never ever underestimate the power of diet and exercise in your corner. And that really brings us to our final thought for today. You know, with more and more people talking about this, and with all these new, less invasive treatments, the future of fibroid care looks more personalized than ever. So the big question is, are we finally getting to a place where a truly empowering and individual approach to fibroid care is within reach for everyone? Something to think about. Thanks so much for joining me.